protests against racism continue during the coronavirus pandemic, analysis shows that racial inequality may have played a role in how COVID-19 spread. Let's connect the dots. As coronavirus spread across the United States, health officials and leaders started noticing a disturbing trend. The virus was taking a larger toll on African American communities. According to demographic data for the entire country, African American deaths from COVID-19 are 2 times greater than what they should be based on population size. And there are signs that racial injustice is a factor. When the coronavirus crisis hit, state and local leaders raced to roll out testing. But analysis has shown that testing was disproportionately placed in wealthier and whiter communities. In Texas, a pretty diverse state, NPR found that in 4 out of 6 cities, there were more testing sites in white areas compared to minority neighborhoods. Only Houston had more testing in minority neighborhoods. And even when more testing was done, and officials noticed that African Americans appeared to be falling sick at a larger rate, there was a reluctance among some to speak up. According to the Washington Post, initially, some leaders in Louisiana and elsewhere were concerned about stigma, worried that people might use the pandemic to ostracize African Americans. Activists also point out that the coronavirus, like other diseases, was able to exploit long-standing social and economic inequality. That includes everything from a lack of quality medical care to a higher likelihood of working essential jobs to a prevalence of multi-generational households.